The following podcast is provided by Athira Pharma and Answers for Elders Radio.
And welcome everyone to Answers for Elders Radio Network. And we are here again on a springtime. It's in the month of April and the flowers are blooming, the tulips are coming up, and there's newness around us. And we're here to talk about a very, very special program for those that are in the beginning or medium stages of Alzheimer's disease. And obviously, you know, we hear about Alzheimer's and how overwhelming, but we don't necessarily know the actual statistics or what's happening out there. And so I felt it really important to our listeners to have kind of a little scorecard. You know, where are we in the progression of towards a cure? And for those of you that are listening, if you know someone that is affected with Alzheimer's or dementia, or have a loved one that is, this is an important program for you to listen to. And we are very, very honored and to have Dr. Verghese from the Keystone Clinic in Philadelphia area. You're actually, Dr. Verghese, you're in Plymouth Meeting. Is that correct? Pennsylvania, outside of Philly. And I am so thrilled that you are with us. So welcome to the program.
Thank you, Suzanne. And thank you for inviting me to this program. I am really passionate about the cause of educating and finding cures, treatments for Alzheimer's disease. Anybody who's ever had a family member or seen someone with Alzheimer's disease cannot think and behave the same way after that. Mm-hmm. My own mother died of Alzheimer's 5 years ago.
Oh my goodness.
And that experience really transformed my efforts as a physician investigator. We at Keystone Clinical Studies are almost completely devoted to Alzheimer's disease, and we've stopped working in some of the other areas that we used to work in because we see that this is such an important thing for individuals, for society, and for the world at large.
Yes, yes. And obviously working with Athira Pharma, who we love and certainly work with, you know, you guys have been able to team up with some medical breakthroughs, and we're going to talk about that this hour, about, you know, what's being done, what is the process, how can you get at the front of the curve of what's happening with treatment out there. And so obviously I want to talk a little bit before we get into that, Dr. Verghese. I would love to talk to you about just overall, where are we with Alzheimer's in this country? You know, I mean, it's overwhelming, the statistics.
Right. So before we go a little further, I just want to clarify some concepts.
Okay.
People kind of think that Alzheimer's and dementia are the same. They are not.
No, they're not.
Dementia means brain failure. It's not a disease. It's what we in medicine call a syndrome. And there are many causes of dementia, and Alzheimer's disease is the biggest cause of dementia or brain failure. Mm-hmm. HIV can cause dementia or brain failure. COVID can cause dementia. Drinking too much can cause dementia or brain failure. Mm-hmm. Playing too much football can cause, you know, chronic traumatic encephalopathy and brain failure. So dementia is when you're not able to look after yourself.
Yeah.
And Alzheimer's disease has a whole spectrum of clinical presentations till the brain is so impaired that you have Alzheimer's dementia. Mm-hmm. Alzheimer's disease is the cause of 2/3 or more of dementias in the elderly. Yeah. As we live longer, there is more and more Alzheimer's disease. Mm-hmm. In the old days, you know, they would even call it old-timers disease. Because it's only the people who survived into old age developed Alzheimer's. But if you look at the statistics, if you look among 65-year-olds, the prevalence of Alzheimer's dementia, is 5%. If you look at 70-year-olds, it's 10%. Mm-hmm. If you look at 75-year-olds, it doubles to 20%. If you look at 80-year-olds, it's 40% or more.
My goodness.
So the longer you live, the more likely you are to develop Alzheimer's dementia. Today, we have about 5.8 to 6 million Americans with Alzheimer's dementia. And I keep saying dementia because the early stages of Alzheimer's disease is probably a lot more prevalent, and we don't even know how much that is.
No.
A quick scary statistic is that the Harvard Aging Brain Study, which looked at the brains of so-called normal people, found that 1 out of 3 people in that study above the age of 60 had the amyloid protein in their brains on PET scans.
And what is that protein? Just
amyloid is the protein that starts a cascade of changes in the brain that lead to Alzheimer's disease and later on Alzheimer's dementia. So amyloid is a toxic protein that the brain reacts to, and it starts an inflammatory process. And that's what releases, amyloid is the plaques. And the plaques release the tangles. The tangles spread around the brain and cause neurodegeneration everywhere. So coming back to the Harvard Aging Brain Study, 1 out of 3 people above 60 had this toxic protein. And in about 15 to 20 years, it becomes Alzheimer's disease. So there's a long incubation period, as it were.
So do you find, and this is just a point of curiosity, they have that protein, I'm sure that's a contributing factor, but do you obviously recognize the fact that in a lifestyle in their everyday life, does that necessarily affect them? Number one, in their everyday life in their younger years, you don't even have it and you don't realize. But another thing is, what about your lifestyle? Maybe you don't use, mind activities as much in your earlier days. Is there any studies in that area as far as how your earlier life affects later life with Alzheimer's?
Great question. So let me unpack that. So these people who had the amyloid in their brain, on the outside, they did not look any different. But when they did very high resolution MRI imaging of their memory center in the brain, it had already started to shrink.
Wow.
Yes. And when they did high-end neuropsychological testing, they were they performed less well compared to people who didn't have it. So having the amyloid is not good for your brain.
Right.
It's just that when we get into our 60s, we do things by rote. We don't have to learn a lot.
Right.
And so it's not exposed. We are not brought, the difficulty is not shown up. I had a patient who was the CEO of a company. He could run his company, but they went on a cruise and he fell apart. Why? Because it's all new learning.
Yeah.
And what goes first in Alzheimer's disease is new learning. So these folks who have the amyloid have difficulties in new learning. It's just that there isn't enough awareness to grab onto that.
So then what
answer
about
your question about middle age?
Go ahead.
What's good for your heart is good for your brain.
Got it.
So controlling your sugar, your cholesterol, your weight, regular exercise, aerobic exercise, social connectivity does help, but it's not curative like anything else, like cancer, HIV, heart disease. It's medicine and lifestyle. One doesn't fully address it, but without the medicines, you really can't stop the process in your head. Sorry.
That's okay. No. So then my next question is, what about adults that maybe you're a fully functioning adult, but you may be somewhat on the spectrum, or you may be in a situation where you've got ADD or any sort of neurological condition? Does that affect it?
When you say the spectrum, you mean autism spectrum?
Sorry.
There is no connection between autism spectrum disorder and Alzheimer's. ADD is something that starts early in your life, like in your teens and young adulthood, and lasts throughout your life. So I don't think that either of these predispose or can be confused with Alzheimer's disease. Most people with Alzheimer's disease have very high levels of functioning, and then they start to go down in their 60s and 70s. With one caveat, people with Down syndrome who have 3 chromosomes, the 321 chromosome 21 copies. 100% of them develop Alzheimer's disease in their 30s.
Oh my goodness. Oh my goodness. Well, and we know that at least it's been in my experience that we know that early onset Alzheimer's can escalate more quickly
Correct.
than when you're diagnosed in your older age. And that's probably because your brain, I'm assuming, has a little more functionality, or is that a reason?
It's just a more aggressive form of illness.
Okay. So when you're younger, it moves faster through your system.
Right.
I know, I just lost a classmate of mine not too long ago. I mean, he's like my age, 66. And he, I mean, he was diagnosed and 3 years later he passed away. It was so fast.
Right.
It was just overwhelming. I couldn't even believe it. So it's just fascinating how this disease has hit our country. And of course, we're closing. I just really want
Can I leave you with one statistic?
Yes, please do.
There's a new case of Alzheimer's every 65 seconds in the US. And it used to be every 67 seconds, and some say it's even every 63 seconds. So in the time we were speaking, about 11 people have developed Alzheimer's disease, and globally it's every 4 seconds.
Oh my goodness.
So this is a disease that is increasing in prevalence as we go along.
Well, and I know in our state, in the state of Washington, our statistics are overwhelming. I believe the latest came out, there's like in the state of Washington alone, there's over 150,000 of our residents that have Alzheimer's disease, and they're being cared for by close to 400,000 unpaid family caregivers. And that tells me there's a huge issue in this state, let alone the country. And Dr. Verghese, you're going to be with me this hour. So for each and every one of you, he and I will be right back. And we're going to talk a lot more about Alzheimer's disease and how, if you know of someone or you have a loved one, how you can get involved in a very important clinical trial that could put you ahead of the curve in finding a cure for this disease right after this.
The preceding podcast was provided by Athira Pharma and Answers for Elders Radio. For more information about the Alzheimer's clinical trial, go to athiraclinicaltrials.com.